Hello all, myself Dr. Selvalakshmi, Assistant Professor from the Department of Periodontiology, Vinayaka Mission Sankaracharya Dental College, Salem. So today we are going to see about influence of stress on periodontium. Most of us are filled with 90% amount of stress, with so much of anxiety, without sleep, worry, pressure, conflict, pain, sadness, so much of expectations and too much of work. And the remaining 10% is only filled with humane nature. And you may think, why I need to know about this? Because some patients may not be as mentally healthy as their appearances suggest. So, and also not only the bacteria are required to cause periodontitis, it also requires a susceptible host. That's why we need to know the relationship between stress and how it is related to the initiation and progression of the periodontal disease. Okay. So, in general, stress is defined as the reactions of the animal body to forces of a deleterious nature. It can be either infections or any other various abnormal states that tend to disturb the normal physiological equilibrium. That is, whenever the physiological equilibrium is disturbed, that may be termed as stress. Okay, this is in general definition. Okay, next we have the psychological definition. So in psychology, a physical or a psychological stimulus which when impinging upon an individual, it produces strain or in case disequilibrium. Okay, so now it's clear that our body makes no differentiation between psychological, physical and the social stress. Okay, so now moving on to the psychosocial stressors. Okay, they are classified into two types: major stressful life events and then minor daily stressors, or in case we can term them as hassles. And then Holmes et al. Developed a scale to measure the stress in terms of the life changes. So here is the scale. In this scale, the life events are ranked in the order from the most stressful event and to the least stressful event. And then we need to know about what is a stressor and what is a coping. Okay, first of all, stressor. Stressor is defined as forces that had the potential to challenge the adaptive capacity of the organism. So basically stressor is nothing but the forces that causes or induces or promotes stress. Okay, stressor causes stress, that's it, simple. Then coping. Coping means response of the individual to the stress. It can be either emotional nature or in case physical nature. And then we can experience either positive stress or negative stress. The positive stress is termed as eustress, and then the negative stress is termed as distress. So we have eustress and distress, the positive one and the negative one. In psychology, the researchers generally classify different types of stressors into three categories. The first one is crisis or catastrophes. They are unforeseen, they are unpredictable, we can't predict it, and it is completely out of control of the individual. For example, it can be either major flood, earthquakes or any wars, and they are rare in occurrence. And then comes the second one, major life events. The common example are marriage, going to the college for the first time, death of a loved one, birth of a child. As we already said, stress can be either positive or negative. Positive is eustress and the negative one is distress. Then daily hassles are the micro stressors, and these are the most commonly occurring type of stressor in individuals' everyday life. And this includes daily annoyances and any minor hassles that are happening in a day-to-day life. And the examples are making decisions or meeting the deadlines at a work or in a college or anything, and then traffic jams and encounters with the irritating personalities on a day-to-day basis, and then conflicts with other peoples also. Okay, and the next one is the important thing, stress coping strategies and the tools we are using to cope the stress. Basically, coping is the effort to try to reduce. Either we can reduce it or we can control it or we can tolerate. Coping is the effort to try to reduce, control or tolerate the state of stress. And we can employ different types of coping on a daily day-to-day basis, and it varies from individual to individual. First one is the resigned coping. where we avoid the stress, where we escape from the stress. And then the active coping, which is the best one, where we have control over our situation and also over our response to the stressors. We positively self-instruct ourselves to come out of the stress. And then destructive coping, where we simply distract ourselves from the stress. And then defensive coping, where we are filled with guilt, self-blame. And then coping with aggression and drug use, which is the deleterious one, where the peoples will become aggressive and they will start to use drug use. Okay, and now people are acquiring a more deleterious coping technique, that is whenever they are stressed, they used to stress others, right? Next, coming to the molecular part. So here is the molecular and endocrine mechanism of the stress response. So this flow chart comprises all the events from how stress converts the healthy periodontium to a diseased one. Okay, so first of all, stress starts by daily hassles, environmental influences, major life events, any psychosocial factors, and the systemic illness. When the people are having a positive coping mechanism, that is active coping, where they are having control over their response and over their actions, then there won't be any issue at all. But people who are having a poor coping mechanism, the other sequel will start. Either the hypothalamus will activate and it will ultimately leads to increased susceptibility to the periodontal disease, and the autonomous nervous system can be activated, or the people may start using or addicted to the health impairing behavior. This we will see in detail one by one in the further slides. So first one is possible mechanism of action of the psychosocial factors on the periodontal tissues. So first one is neglect of the oral hygiene. Whenever people are in stress, they won't take much care of the oral hygiene. And then changes in the dietary intake. Whenever we are in stress, we will become foodie. We will excessively intake lots of carbohydrates, sugary drinks, and we will take softer diets in more. So they require less vigorous mastication, and that ultimately leads to initiation of a disease. And the third one is smoking and other harmful oral habits. Smoking is possibly the most important in relation to worsening of the periodontal condition, and that is related to the effects of the circulating nicotine that are formed due to the smoking habit. And then bruxism and clenching, and they are thought to be induced by stress, and they adversely affect the teeth and the surrounding periodontal structures. And then coming to gingival circulation, Manhold et al. In the year of 1971, he conducted a study where they tested the hypothesis that in long or continued emotions, a constant constriction of the blood vessels was found. When the blood vessels will constrict, then the oxygen and the nutrient materials that supply to the periodontal tissues will also reduces, right? And also they found a lower ability of the tissues under stress to utilize the remaining oxygen also. So that adversely affect the periodontal tissues. And then endocrine changes, which is the important one. Alteration in the concentration of the adrenal corticoids. Okay, this is the important one. The adrenal corticoids will get altered, and then other hormones also will get altered in terms of stress. And stress can alter the pituitary functions, and subsequently it influences the carbohydrate metabolism and also the calcium metabolism that adversely finally affects the tooth mechanism. And then stress induced hormones in the gingival crevicular fluid they provide nutrition that favors the subgingival growth of pathogenic microbial populations that ultimately leads to initiation and progression of the periodontal disease. And this is the important one, hypothalamic pituitary adrenal axis. This axis helps in understanding how stress ultimately leads to periodontal disease progression or any other systemic disease initiation and progression. First of all, it all starts with hypothalamus. Hypothalamus gets activated, and this hypothalamus releases corticotropin releasing hormone, that is CRH. And this CRH, what it do was it activates the pituitary gland, and this pituitary gland releases adrenocorticotropic hormone, that is ACTH, and this ACTH finally activates the adrenal gland which are present over here, and this releases cortisol, and cortisol is the stress hormone, and this HPA axis controls reactions to the stress, and also it influences the digestion, the immune system of our overall body. And then the next one is the alteration in the salivary flow and its components. And it was assumed that both whether there is an increase in the salivary flow or decrease in the salivary flow, both induced by the emotional disturbance, it affects the periodontium adversely. And then emotional distress also produces changes in the salivary pH and its chemical composition. Next we have lowered host resistance. Under stress there was an enormous release of adrenaline and noradrenaline, and what they do was they will alter the immunological process. They increases the amount of interleukin 10 and decreases the amount of interleukin 12. This ultimately leads to the shift of the immunological profile from Th1 to Th2 profile, and what these will do was it decreases the CMI. CMI means cell mediated immunity. This interleukin 10, interleukin 12 alteration leads to Th1 to Th2 profile shift, and that ultimately leads to decrease in the cell mediated immunity. And then stress and the neuropeptides influence. So these stressors, what they will do was it will activate the autonomic nervous system, that is RANS, and that releases neuropeptides. They are nothing but substance P, and this substance P is nothing but a inflammatory mediator that causes excessive amount of cytokine production in response to the stress, and these excessive cytokine that are produced are ultimately leads in the periodontal disease. So next we have Cohen's perceived stress scale. So here is an activity for you all. So what you are all gonna do was you are gonna scale your stress level. So here we have a set of questions here, and then you have a response score here. So what you gonna do was score your stress. So it comprises of around 10 questions, and finally you are going to calculate all your scores, and finally we are going to see the interpretation of a stress score you all got. So this is the interpretation of your scores. If you got a score level of 0 to 13, then you are experiencing low stress, that is a good one. Next, if you are experiencing a score of 14 to 26, then you are experiencing moderate amount of stress. And then if you got 27 to 40, you got high perceived amount of stress, and this implies that you need to work on an active coping mechanism to overcome the stress. Then the important one, the models for the role of stress in the periodontal disease. Jenko et al. In the year 1998, he proposed two models. Okay. They evaluate the role of psychosocial stress and the coping behaviors in the periodontal disease. So model 1, it involves activation of the central nervous system and also the autonomic nervous system, and this model shows the direct impact of stress on the periodontal disease initiation. And then the model 2, it involves behavioral changes, that is the indirect impact of stress. Model 1 is the direct impact of stress, and model 2 is the indirect impact of stress. So here is the model 1. So first of all, patients are experiencing psychosocial stress. If they are having adequate coping, none of these actions will take place, and whenever they are having inadequate coping technique, then this periodontal disease progression will take place. So in case of acute stress, when the patient is experiencing acute stress, the autonomic nervous system will get activated, and that activates the adrenal medulla. This releases epinephrine and norepinephrine, and this ultimately increases the level of prostaglandins and proteases and other inflammatory mediators too, and that ultimately leads to the periodontal disease progression. That increases the severity of the periodontal disease. And this is for the acute part. And then coming to the chronic part of the stress, where hypothalamus get activated, and it activates the pituitary gland, where it releases ACTH, adrenocorticotropic hormone, and this activates adrenal cortex, where it releases cortisol, and then that cortisol depresses the immunity, this decreases the IgA, immunoglobulin A, G and the polymorphonuclear neutrophils, which are the first line of defense, right? And this increases the amount of infection and ultimately leads to periodontal disease. Okay, in case of acute, adrenal medulla gets activated and releases norepinephrine and epinephrine. In case of chronic type of stress, adrenal cortex get activated and that releases cortisol. That's the main difference. So this is the model 1 of periodontal disease progression. So the model 2. Here psychosocial stress affects the behavior pattern of an individual. No endocrine part is involved. This comprises the behavioral part of the individual. Okay. The patient may get started to smoke. Smoking ultimately leads to periodontal disease based on the effects, depends on the effects of the nicotine. And then patient tend to overeat high amount of fat diet. Okay. That ultimately leads in the increased amount of cortisol. Cortisol is a stress hormone that depresses the immunity, increases the bacterial infection and ultimately leads in periodontal disease. And the next one is poor oral hygiene and poor compliance of the patient towards a successful treatment part that ultimately leads in increased amount of bacterial infection and periodontal disease progression. So here is the relationship of stress with the various other systemic diseases. So first, what happened whenever we are in stress was alarm reaction. Whenever we are experiencing stress, it activates the adrenal cortex to release the corticosteroid. First one is the alarm reaction. So next one is the resistance stage. After alarm reaction, the resistance stage took place where the corticosteroids prepare our body to adapt to and resist the stressful incident. So this is the second part. And the final one is the exhaustion stage. This occurs when the causative stressful event is not suppressed. And at this point, the body's ability to resist the stress is overwhelmed. And that overwhelming reaction causes damage to the target tissues. This is how the stress is related with the other systemic diseases also. And this flow chart comprises how stress is related to the periodontal disease, and as we already know, periodontal disease is already related to other systemic diseases like diabetes mellitus, osteoporosis, preterm delivery and cardiovascular diseases. And then stress reduction protocol in a dental office. What we need to do whenever a patient with so much of stress or so much of anxiety enters our clinic or our hospital. First of all, we need to recognize their medical risk, medical history we need to recognize, and then patient with severe amount of anxiety we need to recognize all the patterns, and then we need to monitor the vital sign of the patients followed by medical consultation, and then we need to schedule the patient appointment based on the patient status, vital status, to reduce the anxiety level. And if needed, we can pre-medicate the patient to reduce the amount of anxiety they are experiencing. That's why to get a favorable results in a treatment procedure. And then we can advise the patient to reduce the stress. We have certain stress reduction protocols. We can advise them to engage them in an exercise or advise them to start reading a book or listening to a music, spa, yoga, playing with their pets or any social networking. Okay, this will reduce the amount of stress the patient are experiencing. And then, so this slide compiles the overall relation of stress, how it transforms the healthy periodontium to a stress periodontium. That is periodontal destruction. So whenever we are in stress, HPA axis gets activated. HPA axis is nothing but hypothalamic pituitary adrenal axis, and that axis gets activated, releases the cortisol hormone, increased amount of cortisol levels after HPA axis gets activated. That leads to suppression of the immunity and finally periodontal breakdown. Okay. And the next one is the behavioral pathway. The previous slide is the endocrine part and this one is the behavioral pathway. So whenever the patient is in stress, the patient may follow poor oral hygiene. They won't maintain their oral hygiene that much. That leads to increased amount of plaque accumulation that ultimately leads to gingival inflammation and finally periodontitis. So, to conclude, studies to date strongly suggest that stress, distress and inadequate coping are important risk indicators for periodontal disease initiation and also progression. So, addressing the stress may improve not just the quality of a life but also the outcome of a periodontal therapy too. Thank you all for a patient listening.